I'm Tim Hughes, a haematologist and leukaemia researcher from Adelaide, Australia. I work at the South Australian Health and Medical Research Institute, or SAHMRI, and also at the hospital right next to SAHMRI, which is the Royal Adelaide Hospital. I've trained in haematology in Sydney and then got the opportunity to go to Hammersmith Hospital in London and work with John Goldman, who was a legend in the field of leukaemia, and particularly in the field of chronic myeloid leukemia. And that really caused me to focus on the enormous challenge of treating patients with chronic myeloid leukemia, where at that time in the late 80s and even into the 90s, virtually all of the patients, many of them relatively young, would have a few years of treatment but then progress into an acute leukemia and die. So it was a devastating disease, but it was a fascinating disease as well. And through John's mentoring, that became the topic of my ongoing research, which I pursued in Los Angeles briefly and then came to Adelaide. Had the opportunity, because of, I think, quite a visionary leader at the medical centre in Adelaide, to pursue research as well as pursue clinical activity. So I had a large group of patients with CML, and I had a group of young scientists who were really focused on trying to understand this disease better and lead to better treatments. We've had the privilege of studying chronic myeloid leukemia during this last couple of decades, where we've had the availability of kinase inhibitor therapies, and that's just revolutionised the field from a virtually universally fatal disease to one where we can control the disease long term with treatment. And increasingly now we're understanding that some patients can actually stop their therapy altogether and remain in remission. So that's been the big focus of our research, going right back to 2006 when we first started our trial of patients who'd achieved a very deep response to therapy, stopping their drug and following them over time, and finding that at least half of those patients have been able to remain off therapy over the long term. And we're trying to increase that availability to more and more patients, as well as focusing on the 10% or so of patients who actually don't respond to this new therapy and still die of their disease. So that's the major focus today, is to try and improve outcomes, both in terms of expanding the number who can stop therapy, but also improving the overall survival rate for patients with chronic myeloid leukemia. I have almost 500 patients that come and see me on a regular basis at various stages of their treatment with chronic myeloid leukemia. It may be patients, a young mother at diagnosis, asking whether they'll still be able to have a family. It might be a middle-aged gentleman who's going to start treatment and wants to know whether he'll still be able to run and do marathons, etc. It might be an elderly person that's worried about the fact that they've got other diseases as well that create a challenge when they take on the treatment for CML. Everyone has a different challenge when they face the diagnosis of chronic myeloid leukemia, and I feel that I can take those challenges and try and understand them better in the research setting. And the really positive thing from my point of view is that virtually every patient that I've asked to be involved in a trial, whether it be a large national or international trial or just a local trial understanding some particular feature of CML, has been more than willing to be involved, because they understand that what is learnt today may not benefit them but will clearly benefit patients in the future. So that makes this journey with patients even more enjoyable. Besides studying CML and looking after patients with CML, I like to get out and hike, and that's been a major activity for me over many years. And luckily it's linked in well with my interest in CML, because for many years I was chair of the International CML Foundation, and one of our major fundraisers was to climb mountains. We climbed Mount Kilimanjaro in 2019. We recently came back from the Annapurna base camp in 2023. And both of those, that brought together 25 researchers, patients, who all have a commitment to CML, to raise money and to climb those mountains. And that really brought some of my passions together in a really nice way. So that's been a very enjoyable experience.